Welcome to this OWHC Chats podcast episode. For this episode, we're speaking with Jude, who is the Senior Corporate Partnership Officer at the Heart and Stroke Foundation. In this role, she forms meaningful relationships with partners on behalf of Heart and Stroke Foundation. And this is important because heart disease and stroke is the leading cause of death in Canada. For Jude in particular, she has a personal story when it comes to her loved ones and stroke. And for this episode, she's speaking to us about the overall work of the Heart and Stroke Foundation, about how June is Stroke Month in terms of advocacy and health promotion. And overall, through this episode, you're going to learn a number of practical tips you can take with you to your workplaces and to your loved ones as well. Some facts about Jude is that she's certainly a trivia fanatic. She loves Jeopardy, as well as traveling, reading, supporting rescue dogs, and taking long walks. This was fantastic to have Jude on the episode with us, and we hope you enjoy all the learnings that she shares. With that said, here's the episode. Hey Jude, welcome to this OWHC podcast episode.
Thank you so much, Nathan, and thank you for having me here today.
You're welcome. And let's begin this chat at a broad level and hear from you first about the work of Heart and Stroke Foundation. If you can educate us on all the amazing work that you have been doing and that the Heart and Stroke Foundation overall has been doing.
Yeah, absolutely. So, right before I started at the Heart and Stroke Foundation, what someone who's very close to me said, well, it's a great place to work because everyone has a heart and everyone has a brain, which is very true. So it's my pleasure to work at Heart and Stroke and to be here today. And really, what Heart and Stroke is dedicated to doing is improving the heart and brain health of people in Canada by preventing and reducing disability and death from heart disease, stroke, and vascular cognitive impairment. And we do that through research, health promotion, and advocacy. The mission of Heart and Stroke Foundation is actually to promote health, save lives, and enhance recovery. So you asked me a great question, which is kind of how do we go about completing this work? And some of the ways we do this is by investing in life-saving research and supporting heart and stroke researchers. We equip Canadians with resources and information to take control of their health. We advocate for governments to invest in programs, campaigns, and policies. And that's for everything from protecting youth from vaping, promoting healthy eating and tobacco free lives, increasing cardiac arrest survival rates, and ensuring universal access to medication in Canada. And finally, but of course, we do a lot of work. We collaborate with volunteers, donors, researchers, clinicians, and people affected by heart conditions, stroke, and vascular cognitive impairment to further our mission.
Yeah, dude, that's amazing. And curious for you, what would you say is your favorite part of the work you do? Because there's so many parts of that. You've mentioned even the words that resonate with our workplace health audience, like you mentioned the word prevention and health promotion. But I'm curious, even just for you, what is your favorite part about the work you guys have been doing so far?
Oh, I mean, that is hard to say because the work we do is incredible. I mean, it's incredibly meaningful for me to work at a charity where I'm directly impacting the lives of Canadians. But I mean, I'm even doing it to help myself because I know this is primarily about stroke, but of course, I work at the Heart and Stroke Foundation. So, for example, women's health is an area that we're significantly starting to research, and you'll see continued research happening in that area. Because, for example, women's hearts are not men's hearts, but most of the research has actually been done on men. Our bodies are not men's bodies. A lot of women don't know that the heart attack symptoms are completely different than that of men. So, I mean, selfishly as a woman and knowing a lot of women in my life, I love the work we're doing in that area. I think it's really important in terms of, equitable access, that women understand these symptoms. So I would say personally, because also I lost someone very close to me to a fatal heart attack a few months ago. So for me, that's for sure the part of the thing I love working with. But related to stroke, I also had a colleague who had a stroke a few years ago. She was very young, and she's not been able to return to work. So, in terms of prevention, again, it's understanding what those risk factors are, which I know we'll talk about that a little bit later. But I mean, there's no shortages of things I love about working at the Heart and Stroke Foundation.
And you mentioned this a second time, Jude. You mentioned, I believe the word used, the phrase you used was equitable access, and then you mentioned earlier accessibility, like of care. And I
Hmm.
that even just chatting with you, that's new to myself. Listening that's on the radar for Heart and Stroke Foundation, just ensuring people that again that accessibility of care. I think that's amazing to learn that's again on the radar for Heart and Stroke Foundation because it's impactful. It's like how do you have the solutions for people, but then how do you make it so that uh, no matter who you are, you can actually be able to take advantage of the solutions, so to say, and that's a whole other ball game. That's fantastic, Jude. Yeah.
Yes, and credit to our researchers because they're the ones who, of course, do a lot of the research. But I mean, it's also thanks to our donors, our listeners, our volunteers. It's an entire system of wonderful people who I work with, and it's just wonderful work that we do in terms of research. And again, you'll hear a little bit about how that research has, directly impacted stroke care and treatment.
And so let's transition into that because you mentioned one of the areas of Heart and Stroke Foundation is advocacy, and then we have each June is Stroke Awareness Month. Can you tell us a little bit more about this whole idea of Stroke Awareness Month, what that means for the Heart and Stroke Foundation, and what you've been up to for the month of June?
Absolutely. So I really do appreciate you inviting me to speak in June, which is Stroke Month. And I just also want to clarify for your listeners what a stroke is, because I know we've talked about it, but people may not know. So a stroke is what happens when blood flow stops flowing to a part of the brain or bleeding occurs in the brain, leading to a death of brain cells. And a stroke is a medical emergency and it requires immediate medical attention. Having said that, though, Stroke Month is actually the perfect time to celebrate how far we've come over the past several decades and the groundbreaking achievements we've been able to contribute by funding research breakthroughs, driving systems change, and increasing awareness. So I'm bringing attention to this because just over 30 years ago, and we talked about research and how amazing our researchers are and what donors' dollars go to. So as an example, over 30 years ago, when someone experienced a stroke, there was almost nothing that could be done for them. And I know that's hard to imagine, but it's true. So, as an example, in the past, before we had these research breakthroughs, if someone was in the midst of a stroke and they would, for example, arrive to the hospital saying they had a terrible headache, the solution for them would be go sit in a dark room. And of course, that's completely changed today. And there's so much more that can be done to treat stroke and support recovery, just in terms of like medicine and obviously immediate treatment. So today, more people are surviving strokes because of these research breakthroughs, but the number of people experiencing them continues to increase. So the reason Stroke Month is so important is that more than 89,000 strokes occur every year, and the number of Canadians who are living with stroke has actually increased to 878,000. On top of that, what people may not realize is stroke is on the rise in Canada, of course, due to an aging population, but more and more younger people are actually having strokes. And I did want to make sure people know that strokes can happen to anyone at any age, anywhere. So, because of Stroke Month, um, it helps us do things like, prevent stroke, raise awareness, improve treatment and recovery, and again, ensure equitable access to proper care. And during Stroke Month and beyond, so we talk about Stroke Month being June, but of course, it doesn't stop for us in June. We will continue to focus our efforts to improve stroke systems of care and patient outcomes across the country.
Yeah, yeah, and I'm just thinking how it is nice, Jude, that you mentioned how things have changed over time. Like you mentioned, the idea of the dark room from a number of years ago, but it's not the case, and it's because of organizations like the Heart and Stroke Foundation that the way we approached a stroke a number of years ago is not the case today. And you bringing awareness to all this to educate people on this, I think, is extremely important.
Absolutely.
Yeah. And then you even mentioned how stroke can happen to individuals who are from the younger population
Hmm.
as well, which I think is it's what was that phrase you said? You said it could happen to anybody at any age at any time, was it?
Anywhere.
Anywhere, yeah.
Anywhere. Yeah, because I know we're talking about it could happen in the workplace, it could happen in your home. Um, I mean, I think people think of stroke as something that only happens to older people. And of course, it can happen to older people. But like I said, I mentioned that colleague I had, she was, I believe, younger than 35 years of age. So I think it's really important for people, and I know we're going to get into this shortly, but it's really important for people to understand even how to recognize a stroke.
Yeah. And let's get into that, Jude, because that's exactly why we wanted to bring you on for this episode and for you to share these tips, because it's one thing for it to learn about stroke, but it's now let's get into the practical part about what people can do to support themselves, to support their loved ones, even in the case of workplace health, to maybe support coworkers in some way. So, in terms of stroke awareness, June being Stroke Month,
Hmm.
do you have any kind of tips individuals they're listening right now um, they can take away and bring to their lives in terms of stroke awareness?
Absolutely. So I did want to mention that stroke is actually the third leading cause of death in Canada. And it's actually one of the 10 most expensive causes of acute care hospitalization in Canada. And it's estimated to be an annual cost of $146 million. So there are many, many ways that all of your listeners can play a role in raising stroke awareness for themselves, as you said, loved ones, friends, and colleagues, because I've heard many stories of people sort of how they can help their colleagues. So we talked about learning the signs of stroke, which again can happen to anyone and anywhere at any age. And what we learned about the signs of stroke, it's actually 4 out of 10 Canadians don't know what the signs of stroke are, but the inverse of that is that recognizing the signs of stroke can actually save a life. So it's a very simple acronym that people can learn. And that acronym is FAST, which is FAST. And I will go through what each of those letters means. So FAST stands for your face, and that F is face. Is it drooping at all? The A stands for arms, meaning can you raise both? The S is speech. Is it slurred? Is it jumbled? And the T is for time, which is time to call 911 right away. So we talked about how stroke is a medical emergency, but the T is so, so important because the faster you can get a stroke treated, the more likely it will be that they can start treating you immediately and greatly reduce the impact of stroke. So, what that means is please do not drive yourself to the hospital if you think you're suffering from a stroke. And again, the more we remind people about what the signs of stroke are, which once again is fast, the more likely they can recognize a stroke, act fast, and call 911 if it happens. And once again, life saving treatment begins the second you call 911. And sharing fast across your network can actually help spread awareness and again get people that critical treatment right away. And we know that the more people are actually surviving stroke because of increased public awareness of the signs of this medical emergency, and again, really putting the emphasis on the T, which is the need to call 911 right away. We've heard so many stories about how, for example, kids in their jump rope for heart assembly, we've had kids who've actually called 911 and like saved their parents' lives because they recognize the signs. So it's very critical that people know what FAST stands for.
It's that awareness. Uh,
Yes,
yeah. Yeah.
100%. Because again, like for as soon as people recognize it, um, they can do something about it. So please, it just helps us access that. But yes, awareness is everything. Treatment is everything. We have some of the best stroke centers in Canada. We are one of the leading countries when it comes to stroke care and treatment. So it's so important.
And Jude, before you continue, I'll just emphasize that acronym for everyone that you mentioned, which is FAST. FAST. Face, arms, speech, and time. The signs of stroke, FAST. FAST.
Yes, thank you for emphasizing that. Again,
We
I
have
can't
to.
say it
It's
again.
so important. Yes.
Yeah, it's just, I mean, it's very easy when you think act fast. I mean, it's right there. So we hope that people do. And you can save the life of your loved ones, your colleagues, your friends. It's so, so important.
Yeah. And anything else you think our listeners should be aware of in terms of stroke awareness and taking this information again to their loved ones or colleagues or the overall work of heart and stroke?
Absolutely.
Yeah.
Yeah. So another important thing is actually understand your risk factors for stroke or heart disease. So, if you can believe it, 9 out of 10 Canadians have at least one risk factor for stroke or heart disease. And some of these risk factors include unhealthy diets, not getting enough exercise, smoking, too much alcohol, and stress. But there's also conditions that, of course, have added risk factors like having high blood pressure or diabetes. So it can, of course, be difficult to change everything all at once. But again, we speak to that awareness piece. So raising awareness about these risk factors, and we talk a lot about the workplace. So supporting employees to make these changes can actually be a great place to start. So you can actually visit our website at www.heartandstroke.ca, and there's an entire section on kind of risk and prevention for both heart disease and stroke that you can see. There's quizzes. It's a wonderful, wonderful site, our website. There's even things like healthy recipes, tips on how to get more active. So I highly suggest people check our website out because, again, you can't change everything all at once, but absolutely anything you can do will help. Again, it's that awareness piece. It's that it's our mission come to life.
And that's exactly where I think we both our worlds collided in terms of uh, heart and stroke, stroke month, and then this idea of like health promotion and wellness
Hmm.
programs, which is exactly what workplace health is all part of its all about, is implementing initiatives within companies to help reduce risk factors
Hmm.
for individuals. And it just happens to be in workplaces as a form of public or community health. But well said, Jude, in terms of this is something that the risk factors and health behaviors matter.
Yeah, I mean, and I will say it's been. I mean, I've worked with corporate partners for quite some time, and it has been amazing to see all the incredible changes that workplaces are taking to kind of promote a full holistic mind and body health and wellness mentality. It's been really great to see that be implemented in the workplace. And I know there's a lot of workplaces who are like, what can we do to kind of help our employees out? And certainly even just making sure your employees are aware of, again, things like fast, things about like healthy eating, moderation. Maybe there's yoga. Maybe your employees can go for a short walk together. It's small changes, but they do make a huge difference. Like, I mean, the last thing we want to do is make people feel, oh no, I have all these risk factors, so I just feel overwhelmed and I can't do anything. Like, it's small changes that can make a huge difference in your health and well-being.
Yeah, I like that. It's a small change, but a big difference.
Absolutely. And there's actually more actions. There's a couple of more that I wanted to bring to your listeners' attention. So, believe it or not, I know this is a podcast, so we have some podcast listeners out there. We have our own podcast called The Beat, and our latest episode is called Stroke Explains, and that's a wonderful episode where you'll hear not only about the breakthroughs that have dramatically improved the outcomes from stroke, but also what everyone should know about stroke signs, risk factors, treatment, and recovery. So, for those listeners who like podcast format, it is available on Apple Podcasts, Google Podcasts, and Spotify. Again, it's called The Beats by Heart and Stroke. And last kind of tip that your listeners can take is you can learn more about the history of stroke care in Canada, and you can hear from a variety of individuals regarding their lived experience on our website, which again is www.heartandstroke.ca. Again, you'll see the history of stroke care in Canada, how that has evolved over the last 30 years, the incredible breakthroughs we've made, the continued work that is happening by top researchers and doctors. And again, there you will also find a bunch of shareable resources on the fast signs of stroke in a variety of languages, including English, French, Chinese, and Punjabi.
I really like Jude that when I was looking at the podcast, The Beat, there were
Hmm.
even topics about. There was one I wrote down here was called heart disease, stroke, and your mental health. So it's this
Yes.
appreciation even from heart and stroke about the holistic side of things and how um yeah the holistic side and being comprehensive with these different approaches to health. So it's
Yeah.
nice to see.
And I'm glad you pointed that out because there was a webinar that we did back in February, which will also be available on our website. Which, it was just that, which was people who, of course, have poor mental health. If they've suffered a heart attack, for example, they're more likely to, potentially have slower recovery or actually have another heart attack because of poor mental health. So I think it's really great to see that, when we're talking about the body, it's not like what's happening in your brain isn't impacting and manifesting physically in your body. So I think it's wonderful to see. That's the approach that we take. And the strides we've made have been incredible. I mean, I'm so honored to work at the Heart and Stroke just to see the incredible work that we've done. Um, we have a wonderful community of donors, of volunteers, of board members, staff members, of people with lived experience who, of course, share so much with us. So it's been a truly wonderful and humbling experience.
And I'll just comment lastly on that I that part about how your approach has been that heart and stroke has used the idea of like the lived experience. So even when scrolling on your social media, there's a number of posts about individuals and their story.
Hmm.
And I think that's amazing. Even in the workplace health world, there's chatter about, we share a lot of statistics and graphs, but there's also this idea of like the human side of it and maybe just leveraging people's stories and their lived experiences to resonate with people. So it's amazing to see that heart and stroke is doing that, is really using that idea of the lived experience.
Absolutely. Yes, because again, like, our mission it's of course to promote health and save lives, but of course it's also to enhance recovery. So yes, thank you.
Yeah, this is great, Jude. We talked about overall Heart and Stroke Foundation. We talked about June being Stroke Month. And I really loved how you brought to the table and you were very prepared with sharing some practical actions for people in terms of the FAST acronym. You mentioned the BEAT podcast. So, a number of different ways for individuals to learn from this podcast episode. So, overall, thanks a bunch for your time. And this is another step for you in increasing awareness for Stroke Month.
And that's really what our purpose is. I mean, the more people who get this understand, again, even just the signs of, of those fast signals is if I can even share that with one person, I will be happy because it's critical to helping.
Yeah. Again, everyone, fast. FAST, face, arms, speech, time, and especially that part about time because you can save someone when you act accordingly and have that awareness. Thanks, Jude.
Absolutely. Thank you so much for having me, and happy Stroke Month to everyone.